Right at the Cath Lab doors, you'll notice there's a red line area. What that symbolizes is that it's a sterile procedural area. You'll see everybody dressed in hospital scrubs with bonnets on, just so you know what to expect when you come in. We'll come in. It's a cold area. We have to keep it that way because our machine is very sensitive to humidity and heat, so we want to make sure it's in good, proper working order for you. There are 4 staff members, 2 rad techs and 2 nurses that'll be with you the entire time. You're the only patient in the room, so you'll have plenty of one-on-one care. We'll move you over to the table. We come at you very quickly. That is not something to be alarmed about. We affectionately call ourselves a pit crew because we're moving so quickly. We get you hooked up to all the monitoring, so an EKG, a blood pressure cuff, an oxygen saturation. We put oxygen on you. We're talking to you the entire time. If you're nervous or in pain, please let us know. We want to make sure that you're comfortable while you're with us. We clean off the area that we decide to, whichever site we decide to go into for the procedure. We can do radial approach, which is going through your wrist, or we can do the artery through your groin. We'll shave any hair that is in the way, and we sterile prep it with sterile soap. After that's done, we put a sterile drape on you. It's blue. At that point, everything on top of you is going to be sterile. So it'll be very important to leave your hands flat to your sides and your legs flat down, and keep your head on the pillow. Once that's all done, we call the physician. He comes in and he'll give you some numbing medication. It's called lidocaine. It's very similar to what we use in the at the dentist's office to numb the location. After that, it feels like a bee sting. After that, you shouldn't feel any pain at all. But again, if you do feel pain, please let us know. We want you to be comfortable. You'll see the machine here. This is what is responsible for taking pictures. It moves all around you. It won't hit you, but it does get pretty close to you. We are taking 3D images of a 2D images of a 3-dimensional object. So we have to move all around to make sure the vessel looks good at every angle. Right there, you can see that is an actual image of a coronary artery, and so that's what we're looking at. We're looking for the contrast to flow through the entire artery. We were looking for any type of pinching of that artery or the artery be completely blocked. All the catheters go through the artery, the access site the doctor chooses, again, whether it be groin or radial. That monitor also shows the doctor all of your vital signs. It can freeze images so he can use them for further reference. And once those images are obtained, then you can choose the course of action, whether it be a stent or a balloon, or how we're going to best take care of that vessel and open it back up. You are hooked up to all of the equipment to make sure that you're in good, stable condition during the case. Along this wall right here, you'll see all of our stents and balloons and our wires and catheters. We want to make sure that all of our supplies are easily accessible and right here, ready at our hands for doctor. Right behind you, there is a sterile table. We can show it. When we are in a case, this is opened. There's a blue drape on it, and all of the doctor's tools and equipment are on this table, ready for him to be able to get to. Like I said, the staff that's in here, there are 3 in here actually, and 1 in the monitor booth back in the back. They are monitoring the entire case, so there's a lot of two-way communication going on, but not to worry, we're all right here in case you need us.